A 72-year-old with sudden onset weakness and loss of sensation following a fall from standing height. Acute onset of limb heaviness and numbness. So, initially, I'm really thinking about this older individual. I'm thinking about a fracture of some sort. Go with the osteoporotic femoral neck fracture. We're just going to go with that. Okay, so next clue here. Unable to move the arms and legs voluntarily, cannot grip objects, lift head off the pillow, or roll in bed. Difficulty breathing deeply. Respiratory efforts appear shallow. Okay, so this does seem a little more serious than I initially thought. So, they can't move the arms or legs at all. They have a loss of sensation. They can't grip objects. They can't even lift their head. So this is now making me think of something more so along the spinal cord injury, or more so of like definitely a serious event here. So if you can't move your arms and legs, it's giving me something about paralysis. And as far as level goes, if you can't move your arms or legs, this seems like a cervical, like a high cervical spinal cord injury. So we're going to guess that. There we go. Okay, we got it. So and in the case here, it actually does say it's a C4, C5 spinal cord injury. So typically, a lot of the things about spinal cord injury, they could be complete or incomplete. Complete is when you have no motor function below the level. Incomplete, you do have some function below the level. This second clue really gave it away, where this patient wasn't able to move their arms or legs at all. And typically, if you do fall and you hit your head, it's typically a hyperflexion or hyperextension type of injury that results in a spinal cord injury, where that vertebrae might even hit the spinal cord, damage it of some way. And so other symptoms again would be our absent reflexes, our flaccid paralysis of all four limbs, and then also affecting the respiratory system. The phrenic nerve innervating the diaphragm is C3, 4, and 5. If this was a C4, C5 spinal cord injury, now you just knocked out two of the main branches of your phrenic nerve and you have respiratory problems. So, pretty interesting case. I'm the PT guy. Follow for more clinical cases just like this one. I'll see you in the next one.